G'day, movers and groovers. We've got 1.3.2 basic first aid and skills that we're looking at today. So, again, Unit 1, Area Study 3, looking at a lot of our first aid stuff, and it's a good spot to start because obviously it helps me out, being if we are out and about on a practical having you guys trained in basic first aid is very beneficial. So we look at things like your general first aid skills, blister management, small wounds, snake bites, severe bleed treatment, CPR, and immobilisation techniques as well. And your key skills for this will be that you'll need to be able to demonstrate and apply basic first aid knowledge and skills. So, for example, if we're out in the field and you're starting to get a blister, showing me that you know what to do automatically ticks off that key skill that you need to show. Hopefully, fingers crossed, touch wood, that we'll never come across any scenarios where we might have to perform CPR or snake bites. But obviously things like blisters and small wounds and just basic first aid things do arise. So yeah, demonstrating that you can put these things into actions ticks that off very well. So a bit of an overview. We look at your basic life support, so doctors A, B, C, D, things like recording your first aid care, so incident reports, group actions, calling for assistance, all those things. We look at blister management, as I said, small wounds, so abrasions and incised wounds, snake bites with the signs and symptoms. We look at severe bleed treatment, so that's internal and external. We'll also look at CPR, so how to give CPR, and then, as I said before, immobilisation techniques as well. So for all medical emergencies, please dial 000 immediately and ask for an ambulance. That's the number one rule. If someone is unconscious, the first thing that you need to do is call 000. So basic life support. Now, doctors A, B, C, D, providing first aid, calling for assistance, recording first aid care, and caring for an ill or injured person, and group actions. First one, hopefully you all might have seen this before. If you've done any CPR or first aid course, you will have come across doctors A, B, C, D. So they are danger, response, send for help, airway, breathing, CPR, and defibrillation. So they're crucial steps that you need to take for a patient who has a serious injury or illness. So you'll see there's a few things there that you need to do. Check for your dangers, check for response. So I think you can use there is another acronym is COWS. So can you hear me? Open your eyes. What's your name? Squeeze my hand. To try and check for a response. If there's no response, send for help. The next one, clear the airway and open the airway. Oftentimes you'll hear people talk about, use the patient's fingers to clear their airway because they're worried that you might get your fingers bitten off. That's very rare. It's very rare that it ever happens. I know obviously no one's super keen to stick your fingers down someone else's throat, but how do you feel if there's something in someone's throat if you're using someone else's fingers? If you're using the patient's fingers that is unconscious, you're not going to be able to feel if there's anything in the airway. So if you have an inkling that there is something blocked in the airway, generally you're safe to use your own fingers. It is very, very rare that they've been bitten off. So the other thing, check for normal breathing. So hearing, having a look at the chest. Then you've got your compressions. So rescue breaths and your compressions 30-2 and a defibrillator as well, which for us, unfortunately, unless someone carries a defib on them, we'll pretty much won't really have access to one of those devices. So providing first aid. When first aid is needed for an ill or injured group member, a person with first aid training should take control of providing first aid to them until they are recovered or medical aid has been obtained. So generally that'll be, I've got my CPR, my first aid, but hopefully you guys will also have this before we go on our practicals. So you guys will be able to help out and assist as well. Other things, though, if you aren't the leader in the scenario, calling emergency services, keeping a history log of the patient's condition, so noting what time, how long were they unconscious, what time did they come to, maybe they then became unconscious again, what kind of things did we do? Did we put them in the recovery position? All those sorts of things as well. Very important. It make it much easier for the people taking over to, I guess, have as much information as they can to help the patient. We never attempt to move or carry an injured person except when necessary to get them to a safe location and where sufficient people to assist are available. This is because it's very difficult and can cause further injuries as well. So one cool thing as well that I've come across is when calling for assistance. So just in general, obviously everyone knows that you call 000 and ask for an ambulance if there is mobile or satellite phone reception. You'll see up in the top right, it says 911 as well. Guess what? You can use that. That works anywhere. It automatically redirects you to 000. So if you panic and you forget 000 and you press 911, then that's fine. It'll automatically redirect you to 000. Same as I think it's, I always forget this, 112. I think it's the UK emergency number. Can't remember exactly, but whatever emergency number you put in, it will redirect you to 000. If we happen to have an emergency communication device, so a PLB, Spot, or an InReach, or a Garmin of some sort, that can also help. One other thing that I've stumbled across as well is with your iPhones. If you have an iPhone 14 or newer, there is even if you have no reception, there is emergency SOS via satellite on iPhone. So basically what happens, say you have no reception, you open your phone, if you try and type in 0 and it says you've got no reception, down the bottom right on the phone there, you'll see emergency text via satellite. Basically, you press that, it comes up with a little bit of information. You've got to make sure that you've got clear skies. Remember, for satellites, it doesn't matter where we are. We need to have a clear view of the sky. And then basically it'll connect you and you'll be able to message emergency services, which is pretty cool. But there's a couple of videos and things to watch there. It's cool. The other thing that I said that's important for people who are not necessarily providing the actual first aid is recording the first aid care. So things like monitoring and tracking the patient's condition, providing medical personnel with relevant information about the patient and treatment provided. These written records should be clear, concise, and factual. This should be provided to medical professionals when requested and otherwise kept confidential. So, for example, if we out on a practical and something happens where I have to perform first aid, I will have to then fill out an incident report form that I can then give to medical personnel, or can be used further down the track if there's any legalities behind it as well. So caring for an ill or injured person, let's say that someone has collapsed on one of our bushwalks, what can we do? So things that you can do until the ambulance arrive include prevention of further injury. So that would be not making sure if they've passed out on the track, make sure they're not trying to get up and walk again, because they might hurt themselves by falling down. Protection from weather. So you would have seen a couple of slides ago, there was a thermal blanket. Other things might include setting up a bit of a tarp. If it's really, really cold, getting a bit of a fire going to get some warmth. Providing maximum comfort. Providing adequate food and water. Providing assistance with personal hygiene, providing companionship and reassurance. One thing with adequate food and water, an important thing is if there is internal bleeding, you're advised not to provide food, simply because it is an internal bleed. They may have to go under the knife, therefore they're going to get anesthesia. And we don't want to have any food in our system if there is an internal bleed. So that's one thing to remember there. Providing companionship and reassurance, explaining what actions are being taken, and aiming to care for the whole person and not just the injury. Okay, so it's not, if I've got someone who's got a cut on their leg, okay, I'm not just focused on the injury. I'm saying, okay, how are you doing? How are you feeling? Because that's your biggest indicator of how bad this injury is. Group actions. What else can you do if you are not the leader? So I can delegate things. This allows people to hasten slowly. So you can consult other experienced members. So that means, hasten slowly. We're going to get things done. It's almost like organized chaos in a way. So other things that you guys can do could be caring for the ill or injured person, which we saw before, recording first aid, which we talked about, ensuring other group members are safe and together. As I said, putting up tents, shelters, getting a stove or fire going, collecting water, and contacting emergency services. And remember, call for help sooner rather than later. And you'll see a lovely photo there of the first aid kit on this group member, which will generally be attached to my pack, but that may change. You may be in charge of the first aid kit. So if that falls on you, then you'll need to make sure that you've got that displayed somewhere where, and everyone knows as well that you are the one carrying the first aid kit. Blisters, probably the most common, I guess, most common type of first aid incident that we will come across, and thankfully, one of the less extreme ones, but if not treated correctly, can be not great. So there's a little image there where you see the no blister. Once you start to experience a hot spot, if you start to feel very warm in one spot on your foot or on your hand, that's when you know, okay, this is friction. That's the best time to stop and your opportunity to protect yourself from getting the blister. So say the blister forms, okay, if it stays intact, you want to try and protect it, because if it's got the roof over it, then it is nice and protected. If the roof tears, though, you want to try and kind of wash it, make sure that nothing gets in it, putting a bandage on the top and something to stick it down, but you don't want something adhesive directly on the roof, because if you need to change it, if you pull that off, that's going to tear the roof off. Okay. So blisters rarely need medical attention unless they are severe and recurrent, caused by burns or due to an underlying infection. If you've got a blister, it's best to avoid bursting it if possible, as it can lead to infection and slow down the healing process. If you do need to pop a blister, you can clean the area thoroughly with soap or disinfectant. Use a sterilized needle, so you put it over a flame. Gently puncture the blister, allow the fluid to drain out, and then let the roof of the blister collapse down onto the base, which acts as the perfect biological natural dressing for the blister. Then cover with a bandage. And as I said, avoiding an adhesive on top of the roof, so that when you take the adhesive off, it doesn't tear the roof of the blister off. Some more continued stuff. So if the blister has burst, don't peel off the baggy skin pocket. Let your body heal the area in its own way, in its own time. So some things: avoid folk remedies, apply antiseptic regularly. Things when you may need to see your doctor or health professional is if the blister is caused by a burn or severe sunburn. If it starts weeping pus, that's when you know it might become infected. Or if you develop multiple blisters without any preceding skin injury. Okay. Prevention's the big one for us that I guess we look at, and that I hope that you guys will take on board. If you know that you are someone who frequently gets blisters, these are things that I'm hoping that you will do out in the field. And doing things like this almost does show that you have ticked off that key skill point in terms of blister management. So wearing properly fitted shoes, moisture wicking socks are great, so they draw the moisture away from your feet. Sports socks, Stopping, if you notice that you've got a hot area on your foot, if you stop and you tape it immediately, don't feel like you're slowing us down. I would much rather you be comfortable. Some of these places we go to, if you experience a blister on the first day of the walk and we've got 3 more days left, I'd rather you get on top of it, than have to worry about it a bit later on. Obviously sunscreen so we don't get burnt, avoid unnecessary skin contact with chemicals, and be careful when dealing with steam as well. Small wounds, so abrasions and incised wounds. So 2 broad ones. Abrasions is when the skin is scraped or broken. So a lovely picture there. I apologize if some of these pictures are a bit nauseating. Some of them are, some of them are cartoons. So, and then incised wounds as well when the skin is cut. So abrasions are breaks or scrapes. These are your, I guess, wounds that often get particles of dirt and stuff inside them. So they're the ones that you want to try and clean. They generally occur on places that are bony and hard. So on your elbow, on your knees, ankles, all those kind of places. The first aid treatment, and I can safely say I've had at least 1 abrasion each year on an outdoor ed practical, so knowing how to deal with them is of benefit. So clean the wound with a non-fiber shedding material or sterile gauze and use an antiseptic such as betadine. If there is embedded dirt, sometimes you can use Savlon as it has a surfactant which helps remove the debris as well. One thing that people forget to do is you then, after you have cleaned it, you then need to rinse the wound after 5 minutes. So don't leave the betadine or the Savlon on there for too long. Just rinse it for 5 minutes with a tap water or whatever clean water that you can get, and then you can reapply some betadine or some Savlon again. Don't scrub. Cover the clean wound with an appropriate non-stick sterile dressing. Change the dressing according to the manufacturer's instructions. If you reapply antiseptic, wash it off after 5 minutes and then readdress the wound as well. Incised wounds. So when there's a sharp object like a knife or glass slices into the skin, the severity of the wound depends on the depth and location of the injury and if any underlying blood loss may occur. Obviously, if an artery is severed, it is a massive medical emergency due to the muscular action of the blood vessels, and they pump out. If you've ever seen a video of an artery that is severed, it is not a pretty sight. So in order to deal with incised wounds, we need to remove clothing around the site for easy access. If it's on the hand, the arm, you're pretty safe. Legs, if you've got shorts on, safe. Let's say we get a cut around the torso, that's where you'll need to remove a bit of clothing as well to make sure that you can easily access it. Apply pressure directly to the wound with your hands to stem blood flow and cover it with a sterile dressing if possible and continue to apply that direct pressure. So bandaging as firmly as you can. If it is a severe incised wound, you need to raise the injured area above the level of the heart. So this helps to stop the blood from pumping out so as strong. So if you say, for example, if it's on your arm, you then want to make sure that you have your arm raised above your heart so gravity can do the work and keep it from pushing too much blood out. Same if it's on the leg, obviously you want to get your patient lying down and you want to see if you can rest that leg up upon a chair or a rock, obviously, if we're outdoors. One big thing, if it is a severe incised wound and it has severed an artery, don't remove the existing dressing if it becomes saturated with blood. Instead, just add a fresh dressing over the top because you want to try and keep it as compact as can. Seek urgent medical attention and call an ambulance if you cannot stop the bleeding or the patient's feeling faint, sweaty, or dizzy. The next one, snake bites. A little bit of a game, I think, in the next one. Yep. Guess the snake. We've got 4 snakes here. I can tell you that these are 4 of the most common dangerous snakes in Victoria. These 4. Any ideas? Have a bit of a think about it. You might have a couple that might come to you. The bottom left is an eastern brown. Tiger snake in the top right. Red belly black in the bottom right. And top left, we don't see too many of. See if you can figure out what that one is. I'll leave it with you. But as for what I've seen on our outdoor red trips, unfortunately, I've seen a brown snake and a red belly black snake on multiple trips. So they are very common. So knowing how to deal with, obviously, thankfully, had no incidents of bites, but at least knowing how to identify them and knowing signs, symptoms, and I guess treatment options as well is very important for us. So 3,000 people are bitten by snakes each year in Australia. We need to be particularly vigilant for any signs of snakes in the warmer months, so spring and summer, around wetlands and waterways. If you see a snake, keep calm, move away from them. The tiger snake, so that one on the right, is the source of the most bites and cause of envenoming in Victoria, so they're quite aggressive. Sometimes it's not always visible when someone's bitten by a snake, and they might not know. So if someone's been bitten by a snake and they have no idea, then symptoms may be obvious for an hour or more after being bitten. So they might be completely fine. They might not even know. It might be until, an hour where they might start to experience some symptoms. So it's very important for us to act quickly, even if we suspect that someone has had a snake bite. So some obvious signs and symptoms are immediate or delayed pain at the site, swelling, bruising, or local bleeding, bite marks, usually on a limb, that may vary from obvious puncture wounds to little scratches that are almost invisible. So they look kind of like 2 tiny little pins have gone into the bite site. But again, that's depending on the size of the snake, how deep the bite was as well. It might just look like 2 little scratches. Faintness or dizziness, nausea and vomiting, headache, abdominal pain, oozing of blood from the bite sites, double or blurred vision, drooping eyelids, difficult in speaking or swallowing, limb weakness or paralysis, difficulty in breathing, and occasionally initial collapse or confusion, followed by partial or complete recovery. So someone might all of a sudden have a big collapse and then they'll get up and they'll think, oh, no, I'm fine. I just had a bit of a collapse. That's very important that we need to recognize that, okay, that might be a sign of a snake bite. So first aid techniques. They are not all venomous snakes in Australia, but regardless of whether we have seen the snake and we know if it's venomous or not, we need to follow our first aid techniques just in case. So we follow doctor's ABCD, which we talked about. We call 000 and ask for an ambulance. We need to lie the person down and keep them still and reassure them. So keeping them as still as possible as to not help the blood, as to help not the venom circulate through the body. We remove jewelry on the limb if able to do so. If it is on a limb, we apply a broad pressure bandage over the site. So for example, if I've been bitten here on my hand, we'll apply a pressure bandage over the site, mark the site where the bite on the bandage is with an X, and then we apply further elasticize, so really tight roller bandaging, 10 to 15 centimeters wide, starting just above the fingers or toes and moving upwards on the bitten limb as far as can be reached. So if I'm bitten here, I put a really, really firm bandage on that bite side on my hand, and then I want to start with a bandage going nice and as tight as I can all the way up my arm, all the way as far as I can get. If the bandage goes up to here, perfect. If it goes up to just here, then that's fine as well. You should be unable to easily slide a finger between the bandage, so showing how tight it is. We then need to immobilize the bandaged limb, if possible, using a splint. So we can use something like a stick if we need to. Keep the person lying down and completely still. Check the color, temp, and feeling in their fingers or toes. Write the time of the bite and when the bandage was applied. Try to mark the location of the bite site. So we talked about that, putting it, so if you've got the bite on your arm, wrap it, put an X where the bite side is, and then do the rest of the bandage. Try to, or photograph the site is a good one as well. Don't wash the venom off the skin or clothes. If we don't see the snake and we don't know what type of snake it is, if we don't have any trace of that venom, then it's very hard to identify what kind of snake bite it is to get the anti-venom as well. Stay with the person, obviously, until medical help arrives. Don't walk, make the person walk, bring the vehicle as close as possible. Do not cut a bite to release the venom or try to suck the venom out of the wound. And a little video there. And there's a photo, as I was talking about earlier, about the small little, almost look like tiny vampire bites. The next one, severe bleed treatment. So again, we look at internal and external bleeds, signs and symptoms of both, and what to do. So bleeding is the loss of blood caused by injuries to the skin. So we've talked about abrasions, small incisions, deep cuts, and loss of limbs. Internal bleeding is not visible and is caused by injuries to the body that can also range from minor bruising of the skin. So any bruise that you get is technically an internal bleed, to massive bleeds that can be life-threatening. So when we're treating an external bleed, we apply pressure, same as our snake bite, to the wound and our small incised wounds. We raise the injured limb above the level of the heart. For internal bleeding, the first step is to call medical emergency or call emergency medical assistance. Okay, so straight away, if we have any inkling that there is internal bleeding, so if there's been a strong force that's been exerted on someone's body and we think, okay, there's going to be internal bleeding, whether that's on the brain, in the chest, stomach kind of area, we need to make sure that we call emergency services. Whilst waiting, we need to keep them warm and still. If they're unconscious, they should be in the recovery position as well. And as I mentioned earlier, we don't give the person anything to eat or drink if we think that they might have a severe internal or even external bleed, because they might need anesthesia for surgery. So what to do in severe external bleeding? Even a small injury can result in severe external bleeding, depending on where it is on the body, and that can lead to shock. So when we're talking about shock, it means the injured person no longer has enough blood circulating around their body. Okay, this can be life-threatening. So in order to treat severe external bleeding, we need to check, obviously, the first doctor's ABCD, check for danger before approaching the injured person. Okay, put on a pair of gloves if possible, because you are dealing with bodily fluids, so we want to avoid contamination. And call 000, or if possible, send someone else to call 000 while you deal with the patient. Lie the person down. If a limb is injured, raise the injured area above the level of the person's heart. So if you're lying them down, they're having their hand up or getting it to rest on something, same as their leg as well. If possible, get the person, if they are conscious, to apply direct pressure to the wound with their hand or hands to stem the blood flow. If the person is unconscious or they can't do it for whatever reason, you need to apply direct pressure yourself. You may need to pull the edges of the wound. So if it is an incised wound, severe external bleed, you may need to push or pull those edges of the wound together before putting your dressing or pad on, and then secure it firmly with a bleed. So if we have a cut, we bring it together, put our bandage on, so we're holding that cut, and the skin is acting like a bit of a biological band-aid. If there's an object that is embedded, we never remove it. We just apply pressure around it. So we have something sticking out of someone's arm. We're going to apply pressure and kind of push the skin in towards that object. We don't apply a tourniquet. If blood saturates, again, we've talked about this, if blood saturates the initial dressing, do not remove it, just add another one, okay? Keeping it as tight as possible is the main goal. So internal bleeding is the next one. Bit different to external bleeding. We can see external bleeding, but we can't see internal, obviously. Although you will find that we talk about bruises, and then you have some other signs and symptoms that tell you someone is having an internal bleed. So obviously the signs and symptoms, if you see a bruise, that's an internal one. But Other signs and symptoms of an internal bleed might be blood coming from an orifice. So we obviously have bowel injury, so they're bleeding from the anus. The head injury, they're bleeding from the ears or nose. Lung injury, so coughing up bloody sputum. Okay, so spit. And urinary tract infection, so blood in the urine. So your head injuries, if you see blood from the ears or nose, not always will blood from the nose, nosebleed isn't always internal bleeding, but if someone has had a sudden impact on their head and they start bleeding from their nose, then you've got to take that into consideration. Not visible internal bleeding. An internal injury can sometimes cause bleeding that remains contained within the body, for example, the skull or abdominal cavity. We need to listen carefully to what the person tells you about the injury and where they felt the impact. Okay, if they felt the impact here, then we need to look for lung injuries. If it's in their chest, we see if they cough up any blood or bloody sputum. Okay, if they feel it in their stomach or their bowel, then they might bleed from the anus, or they may even projectile vomit some blood as well. So, symptoms of concealed internal bleeding. So, things if we can't see, if someone's had a massive impact, they don't display any of those. There's no blood coming from any orifices. There's no bruising. We need to look for a few things. Pain at the injured site. Swollen, tight abdomen, nausea and vomiting, pale, clammy, sweaty skin, breathlessness, extreme thirst, and unconsciousness. So all the general ones. Okay, so they're the signs. If someone has a sudden impact, they are the signs that we need to look for before we can say, okay, I think it's safe. This person hasn't displayed any of these signs and symptoms. We should be okay. I don't think they've got an internal bleed. Okay. Other things to look for if it is specific to concussion. So a concussion is, or sometimes can be, if we have a bleed on the brain, can be very, very dangerous and deadly. So we need to look for headaches or dizziness, loss of memory, particularly of the event. Check for confusion, altered states of consciousness, wounds on the head. So checking the scalp as well. So we're lucky enough that no one's lost their hair yet, I hope, but really checking that scalp and seeing if there's any blood or cuts or anything on the scalp, and then obviously nausea and vomiting. What do we do if we think or we have an inkling that someone has a severe internal bleed? Obviously, the first thing, again, doctor's ABC, we check for danger. Okay, we make sure that there's no danger. We're not going to harm ourselves. The most important person in that scenario is you, and you're looking out for your own health, okay, and your own body. So checking for danger first, getting someone else to call 000, check that the person is conscious. So cows, can you hear me? Open your eyes. What's your name? Squeeze my hand. Lie the person down, cover them with a blanket or something to keep them warm. If possible, again, we raise the person's legs above the level of their heart. Okay, don't give the person anything to eat or drink, which we talked about. Offer reassurance, manage other injuries if possible. Generally, if you have an extreme sudden impact, you will have more than just an internal bleed. You might have a few small abrasions and cuts that you might need to deal with as well. If they become unconscious, place them on their side and check breathing frequently. And if necessary, perform CPR. Another thing, when we're dealing with these internal, external bleeds, especially external, we need to avoid that cross-contamination, okay, because we are dealing with bodily fluids. So if possible, it's a bit tricky for us because we're outdoors. Hopefully everyone will have like a bit of a Dettol squeeze thing that we can use. So you need to try and wash your hands as best as possible, or putting on gloves. There'll always be gloves in our first aid kit. Okay, so if we're dealing with any blood, we need to put those gloves on. Okay, and obviously the obvious ones, do not cough or sneeze over the wound as well. CPR, and there's a fun little video there for you to watch if you've got access to these slides. It's a great video. I'm a big fan of it. So CPR is cardiopulmonary resuscitation, which is a crucial emergency technique for individuals not breathing normally or experience cardiac arrest. It involves chest compressions and rescue breathing to help keep oxygen flowing until the ambulance or trained medical staff arrives. It can be life-saving, okay, and it provides oxygen to the brain and organ, which is obviously vitally important. It increases the chance of survival when medical assistance is not available. So for us, medical assistance, if we're out in the field, medical assistance isn't there as quickly as it is if we are here at school. Okay, it takes obviously a little bit longer for medical emergency staff to get to us. So knowing how to provide CPR is very, very important. It does not guarantee survival. It can significantly impact outcomes by preventing brain injury due to oxygen deprivation. Steps are similar for adults and older children, but the technique differs slightly for babies and young children. We may have a look at that in our practical, but for you guys, the main thing is you're all roughly the same size. We've got no one that is absolutely tiny, so it'll be the same kind of form of CPR that you would provide on me or an adult. So giving CPR to adults and older children, which is us. Aim for 5 sets of 30 chest compressions and 2 breaths, so 30 and 2 in 2 minutes. Do you want to go through that 5 times? Do 32, 30 and 2, 30 and 2, 30 and 2, 30 and 2, 30 and 2. Okay, so 5 times. Mouth to mouth. If you can't do it, it's okay to just stick with continuous compressions at a rate of approximately 100 per minute. With mouth to mouth, generally in our first aid kits, you will have a mouth guard, which is like, not a mouth guard, a mouth covering of sorts, which is a kind of a clear plastic sheet that you can put over the top that prevents that a bit of contamination. Okay. So performing CPR on adults and older children, airways, as we mentioned before, we open the person's airway, so their nose, mouth, and throat. Check that they're clear, remove any blockage, such as vomit, blood, food, or loose teeth. We don't spend too much time doing it. We just get out the main thing so we can get a bit of air in there. CPR is our main priority. So we make sure the person is in a neutral position. So you'll see in the picture on the right, they're on their back and their chin isn't kind of, I guess, directly in line with the shape of their body. Their head's actually been tilted back a little bit, okay? So we tilt it back a little bit, and that just opens that airway rather than closing it. Breathing, are they breathing normally? So if you'll see that in the photo, the girl has her ear down towards the patient's mouth and nose. So they're checking for, can they feel any air or hear any air coming out the nose or the mouth? But they're also doing that. You'll see that they're looking across the line of the chest. So they're looking for that rise and fall of the chest as well. Okay, so there's 2 ways that you can do. Put your ear down so if you can feel or hear anything, and you're looking to see if there's any movement in the chest as well. If you do have breathing, great, perfect. Let's put them, we don't even need to go to CPR. We'll put them into the recovery position on their side, okay? That's to avoid, if they do come to and they vomit, it's making sure that it's not going and choking them. So we're keeping them on the side to keep that airway clear. If they're not breathing normally or they are breathing abnormally, like grunting and grasping for air, we need to perform CPR. So as I mentioned, 30 chest compressions and 2 breaths of mouth-to-mouth rescue breaths. Some chest compression steps. So we place the heel of one hand on the lower half of the person's breastbone. So there's a lovely picture there. You can see that sternum. You're just putting it down, almost down the bottom of that sternum. So right, you almost feel a little bit of a divot just on the chest as well. Some people like to grab the wrist and just perform CPR like this. You might interlock your fingers, okay, whatever feels comfortable, as long as you feel like you can sustain it for a while and it's not going to hurt you or your arms. Keep your arms straight as possible. Press down on the chest by 1/3 of the chest depth. Release the pressure. This counts as 1 compression, okay? Do not panic if you don't have a measuring tape and you can't think, oh dear, what is 1/3 of a chest depth? Okay, just start performing CPR. That is the most important thing. Don't panic and think, I don't know what 1/3 is. That is just think of it and think, okay, this looks like about 1/3. I'd rather you try your best to get 1/3 than not try at all. Okay. So the other thing, getting back to that, is can they be dangerous? Sometimes people will have their ribs broken by chest compressions, but as I mentioned, it's a better alternative of not receiving CPR, because we know not receiving CPR is either lead to brain injury or even worse scenario, death. Okay, so if a rib does break, and you will hear it, it is an audible break. If it occurs, you need to pause, reposition your hands before continuing, or get someone else to take it over if you cannot. So mouth to mouth on adults and older children. If the person's not breathing normally, ensure they're lying on their back on a firm surface. Open the airway by tilting their head back and lifting their chin, which we talked about. You need to close their nostrils with your finger and thumb, so like this. Okay, put your mouth over the person's mouth and blow into their mouth. Make sure no air is leaking. Okay, so nice firm seal, nice tight seal. Give 2 full breaths to the person, so not we want. Okay, nice full breath. Check that their chest is rising and falling. Okay, if you don't see a rise and fall in the chest, that means you don't have a tight seal on the mouth. Okay. If still no luck, check the airway for any obstruction. So if you can't see that rise or fall, there might be something in the throat that's causing that block, and the air's not getting through. If you can't get air into the lungs, go back to chest compressions. Don't think, oh, I did 2 breaths, but I don't think the air went in. Don't panic. You need to go back to compressions. Okay, as the chest compressions might help to shift that obstruction. So do your 30 and 2, aim for 5 sets of 30 to 2 in about 2 minutes. Keep going until either the person becomes unresponsive, they may begin to move, breathe normally, cough or talk, and then place them into the recovery position, or until the paramedics take over. Okay, so until either the person becomes responsive, the paramedics take over, or there is another one. If you physically cannot keep going, okay, obviously you can stop. But we're going to have multiple people in our outdoor practicals, so we have plenty of people that can assist and take over. It's almost like a changing of the guard. So you might have myself doing compressions. Okay, I might have someone else doing an assistant doing rescue breaths, and I might have someone else who's just monitoring the whole situation. Okay, I might go, okay, I'm going to get through this last set of 30 chest compressions, and we're all going to switch. Okay, then we switch. The person who was just monitoring might come over and do the compressions. I'll go to the rescue breaths. The person at the rescue breaths would then go to just monitoring the situation and have a bit of a breather as well. Okay, take a bit of a break. AED, an awesome device. Unfortunately, we won't tend to have them on our practical experiences unless we are somewhere where it is a bit more or not as remote. So we still need to know how to use them. So it's an automated external defibrillator, and it is a life-saving device for someone experiencing cardiac arrest. It can analyze abnormal heart rhythms, and send an electric shock or pulse to restore the heart's normal pumping rhythm. CPR must be continued until an AED becomes available. The pads must be attached to the skin and the machine turned on. Okay, so that's skin. So you might find if someone's got a hairy chest, in the AED pack, it'll generally come with a little razor. You're not going to get shaving cream, but it'll come with a little shaver. You need to shave as much hair as you can off the chest so that you have a firm stick to the skin. Okay, obviously not putting on any clothing as well. Different types of AEDs are available in public places. So we have some here at the school, and they're available at shopping centres as well. The AED is awesome in the fact that it talks to you. As long as the batteries are not flat, it talks to you and it tells you what to do. It says, continue CPR, analyzing the patient, analyzing the heart rhythm, do not touch the patient. And it'll say, continue CPR, or it'll say shock advised. And then you'll move away from the patient, stand clear of the patient, and then you press the button that shocks them. It'll then analyze again. If it thinks, okay, this person's heart's beating, we now need to continue CPR. Okay, if not, then it'll say another shock advised. Okay. As I said, do not touch the person during analysis or shock delivery. Okay, analysis because it might pick up your pulse or your heartbeat, and then get an incorrect reading. Or obviously, you don't want to be touching the patient when the shock's delivered. Otherwise, you might be dealing with two unconscious people. So making sure you're well away from the person. Make sure that knee is not touching the patient either. You need to take a big step back. So a little learning activity for you guys to do. This will be in your booklet for this dot point. So have a bit of a look at that. Make sure that you get that completed, please. And then we're up to our key concepts. That's it. Key concepts. Last one. There's a few there. Obviously, the main one, call 000, ask for an ambulance. Outdoor environments can be unpredictable. So in things like weather, obviously we're dealing with animals, which are unpredictable. Nature is a very unpredictable area, like anything to do with water. So knowing what to do if someone injures themselves is crucial to the success of any outdoor experience. Obviously, trees fall, all those sorts of things as well. What else? When first aid is needed for an ill or injured group member, a person with first aid training should take control of providing first aid to them until they are either recovered or medical aid has been obtained. Written records, as we said, should be clear, concise, and factual. Doctors A, B, C, D. Treating a blister, please make sure that you know how to do that and avoid the temptation to burst it. I know everyone gets keen on, you see those Dr. Pimple Popper videos and they just want to burst the blisters. It is much, much safer if you can try and avoid bursting it and keep that skin on top, because that is the perfect biological bandage over the top. Small wounds, clean with a sterile gauze and antiseptic, cover with a non-stick sterile dressing. Snake bites, again, follow doctor's ABC, lie the person down, keep them as still as possible, applying the broad pressure bandage over the site and then upwards on the limb as far as possible. Manage severe bleeding, we apply direct pressure to the wound, raising the limb above the level of the heart if possible. We talked about CPR, keeping blood circulating and delivering oxygen. Providing CPR, we know 30 and 2 in about 2 minutes. 5 sets of 30 and 2 in about 2 minutes. Obviously, if you don't have a stopwatch, you're not going to have a stopwatch there, so it doesn't matter. You're just trying to keep that dun, 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 dun time, okay? And then a pressure bandage and immobilisation slows the movement of venom through the lymphatic system. And then you need to splint the limb if possible, so using a stick. So that's our immobilisation technique as well. Okay. And that is the end. That was quite a lot. As I said earlier, it's a great topic for you guys to try and get your heads around first, because then if we go out and hopefully nothing will ever happen, but these are things that we need to know how to do, and hopefully it makes you guys feel a lot safer in your outdoor experiences as well. Having that depth of knowledge in what to do if this does occur is it's a great skill, and this is a skill that you will have for the rest of your life, and it's very favorable in a lot of careers as well, having basic first aid skills. So that's all. Please make sure that you go back through this slide. If you followed along just in the video, go through, stop and check those the little YouTube links that I've put in. There's some really, really good information in them. After that, please make sure that you complete the 1.3.2 booklet and submit that by the end of the week. Thank you very much, guys. Stay groovy. Appreciate you all.